Hello, this is Dr. Patricia Coughlin, and I'm here to talk to you today about how to establish and maintain a therapeutic alliance. In my last video, I talked about the vital importance of establishing and then maintaining an internal focus. Without this internal focus on the inner life of the patient, you're really not doing psychotherapy. And establishing that focus, that agreement on what you're really there to do is actually the first step in developing a therapeutic alliance, right? What is that? I think that there are a lot of both preconceptions about it and maybe misunderstandings about it. Most commonly, therapists seem to think of the alliance as really the emotional bond. And while there are elements of that that are in fact important, you being emotionally attuned to and responsive to the patient, it's actually somewhat of a minor element. In order to create a therapeutic alliance, we're really talking about establishing collaboration, this partnership between therapist and patient. And that's made up not only of this emotional bond, if you will, but also an agreement on the problem to be addressed, the goals to be achieved, and the task. What's the therapeutic task? How are we going to get from where the patient is in the difficulty to their goal? And both John Fredrickson and I have made some videos really breaking that down and talking about how to actually do each one of those things. Get the agreement about the problem, the goal, and the task. So that in conjunction with this emotional attunement is really what we mean by a therapeutic alliance. So let's talk again a little bit more about what we mean by this bond, right? This emotional bond between therapist and patient. I think often we think of that as the patient liking us, feeling comfortable with us and things like that. But it really looks like it's about trust. Trust more than liking, in a sense. And that what increases trust is the patient's perception of the therapist's skill and competence. Or is the therapist actually a resource, a trusting, reliable resource, someone who's skillful and competent in helping them both understand really the nature of the problem, what's driving their symptoms, and then agreeing on, oh yeah, so now I can see what's causing my depression, my tendency to turn my anger back on myself. And so since avoiding my anger toward others and turning it back on me is the underlying mechanism responsible for the suffering, then do you agree that facing those feelings, experiencing them, integrating them with other feelings so they can be used to help the patient assert themselves and establish boundaries, right? Can you agree? So as you're helping the person understand that, you're displaying your skill and competence. And that's what's going to fortify trust and solidify the alliance. So that's really the first thing, right? Getting clear about what is the alliance actually. And then the other thing is really important. I think we tend to assume that we develop an alliance first, and then we're going to go to work on the task, right? On the therapy itself. Well, research suggests that the therapeutic alliance, developing that alliance, is just as often the result of therapeutic work as it is the cause of therapeutic change, right? So do you get that? So very often, and especially in more troubled patients, character disordered patients who come in passive or paranoid or, defiant, you're going to have to do therapeutic work in order to establish a therapeutic alliance. So your alliance is the result of therapeutic change, not the cause. And this is really important because again, other research suggests that the therapist variable is much more important than the patient variable when it comes to establishing strong therapeutic alliances. So again, it's your skill and ability to deal deftly with difficult patients who put up obstacles to collaboration, who are either sitting there passively, waiting for you to fix them, or antagonistic, right from the start. I'm thinking about a 69-year-old woman I saw, and she had been, tried therapy countless times and really never had a successful treatment. And so she was being sent really to see me by her primary physician, who was at her wit's end trying to make heads or tails of what this woman was saying. She called her constantly, asked for appointments, and really never had a medical organic problem. And so she referred her to me, and the woman started again by saying, "Oh, why am I even here? I mean, are you normal? Who are you anyway? I don't know why I'm here. What can and this is how it starts, right? So it takes a skillful therapist and someone who, I think it was Wampold, who said that, again, the best therapists and those who can establish alliances, even with these difficult people, are interpersonal masters. They can manage these feelings and reactions and somehow develop a collaborative alliance. So how do you not get caught up in that and become defensive yourself, but somehow say, okay, I can hear just how difficult this is for you. You're not even sure you want to be here or why you're here. So why don't we start with that? I mean, why are you here? What's troubling you? What's going on that I might be able to help you with? So these two things, right, getting clear on the components, what really is a therapeutic collaborative alliance, and then how do you develop that even with really difficult patients? Your ability to do that, the therapist variable here, again, is much more powerful than patient characteristics. So there's a lot more to say about this. This is just a bit of a teaser, right? So we can begin to have the conversation. I wrote a lot about this in my most recent book on maximizing effectiveness in dynamic psychotherapy. So I would certainly refer you to that book for more on this very important topic. Also, I'm going to do another video on how to both detect and then repair breakdowns in the alliance. So sometimes we develop one just fine, but then there's a rupture, there's a breakdown in the alliance. And being able to, again, detect that and deal with it in such a way that the therapeutic alliance is repaired is another incredibly important skill for all therapists to learn. So tune in again for that video. Read more in my book about that. And also really think about attending the IEDTA conference coming up in Boston in September. Again, there's going to be a link below, and you'll just get lots of not only talks about this, but you'll see loads of real therapies on videotape and get a lot of inspiration, knowledge, and skill building to take with you. Okay, until next time, bye-bye.